first step for better health is a good night's sleep. But what is the worst sleeping position that you need to avoid, especially if you're over 50 years old? And what is really the recommended sleeping position if you're currently battling with low back pain, neck pain, hyperacidity, and sleep apnea? This video is short, but this is relatively important because we spend at least 6 to 8 hours of sleep per day. Stay with me until the end because I will also teach you the most recommended sleeping position that had been proven by research to increase your metabolism, because we all know that our metabolism tends to slow down as we age. Hi, this is again Doc Sherry, Doctor of Physical Therapy, teaching you practical health tips and home exercise programs that you can surely benefit from. If you're new here, please don't forget to click the subscribe and the bell button below so you will be updated with our weekly health videos. The quality of your sleep if you're over 50 is not only for your comfort, it is also needed for your health and for your general well-being. But the lessons that you will learn in this video today, you can apply it even if you're still young and if you're watching this video, because it can be very good for your spine. The worst sleeping position that you need to avoid is sleeping on your stomach. This is not really good because this can cause misalignment in your spine. It can increase your risk of having disc disease or damage in your intervertebral disc, and this can also lead to stenosis, wherein the nerves in your spine can be impinged and can give you a variety of symptoms like numbness, pins and needle sensation in your foot, and even weakness in your legs. If you're currently suffering with lower back pain or pain in the lumbar area due to different spinal conditions, the best and the recommended sleeping position for you is side-lying position. A small study was done wherein patients who had lumbar pain were asked to sleep side-lying with pillows in between their knees. And the study found that there was 90% reduction of their symptoms in as far as 4 weeks is concerned. Now, if the pain is more concentrated in your upper back or in your thoracic spine, the best recommended sleeping position for you is supine position with pillows beneath your knees. The same study actually found that those who complained of upper back pain and who assumed supine position with pillows underneath their knees had 90% reduction of their symptoms in as much as 4 weeks. Now this time, I want you to look at this picture. You can screenshot this and this will serve as your guide. If you have lower back pain, picture A is the best recommended sleeping position for you. If you have upper back pain, picture B is the best recommended sleeping position for you, where you lie supine and you have pillows underneath your knees. And the position that you need to avoid, because it can actually exacerbate or worsen your symptom, is picture C. Now let's talk about snoring. If your loved one is complaining that you snore a lot if you're sleeping, the best recommended sleeping position for you is still side-lying. You need to avoid sleeping on your back or supine position because this can actually exacerbate or increase snoring. And this is also the reason why that bed with adjustable bed frame had been proven helpful for patients who snore. This can actually help them sleep better and have improved the quality of their sleep. Now, if you don't have this type of bed frame, what you can do is you can lie supine, but this one slightly elevate your head. This way, we prevent episodes of snoring. Sleep apnea, wherein there is temporary cessation of breathing during sleep. Now, the best recommended sleeping position for this is side-lying, but this time facing your right side. Clinical studies have actually shown that side-lying facing the right side can significantly lower apnea symptoms in even moderate and severe cases. Now, here is the tricky part, because if you have CPAP, it would be more or less difficult for you to assume side-lying position facing your right. So your option is you can do supine with your head slightly elevated using pillows, or you can opt for nasal CPAP, which would make it easier for you to do side-lying sleeping position. If you're currently having hyperacidity symptoms which can give you discomfort, the best recommended sleeping position for you is side-lying, but this time you need to face your left side. Yes, clinical studies have actually shown that side-lying facing your left can actually reduce symptoms of hyperacidity. That's simply because in this position, your stomach is lower than your esophagus, which can actually control hyperacidity symptoms. So for hyperacidity, the best recommended sleeping position is side-lying facing your left side. Before we continue on the best recommended sleeping position, if you're currently having neck pain and to improve your metabolism, at this point, I would like to ask a tiny favor from you to please click the like button below if you think that natural techniques like this are helpful in improving your health. Thank you very much. That is deeply appreciated. Now, let's talk about neck pain. This is very common, and mind you, your pillows can be your ally or your enemy because it can actually lessen or worsen your symptoms. Now, the key to this is not having too high pillows. Too high pillows can actually cause overflexion in your cervical spine. And too low pillows or too soft pillows can also cause hyperextension of your cervical spine. What we want to promote is normal height of pillows that will be able to support the neutral contour of your cervical spine. Now, there are orthopedic pillows that you can buy, and these can help lessen symptoms of neck pain. But it will not be that beneficial if you're not mindful about your posture. Posture education is very important. All throughout the day, avoid the slouch posture because this can actually exacerbate your symptoms, and this can lead to different conditions in the cervical spine like osteoarthritis in the neck known as cervical spondylosis. Now, the best recommended sleeping position that have been proven by science and research to increase your metabolism is side-lying facing your left side. With this sleeping position, it actually helps move food faster from your small intestine to your large intestine. Now, this is a natural technique, and I believe this is helpful because metabolism or slowed metabolism is one common complaint as we age. Now, these are natural but helpful techniques, and because good night's sleep is very important for your overall health and overall quality of life. If you have reached the end of this video, please comment health in the comment section below. Should you have any questions regarding this video, please comment it down below because I would surely find time to get back on you. If you have been diagnosed with sciatica due to osteoarthritis of the lumbar spine, we have a video here. Check on it. It will greatly help you. Thank you very much for watching. I will see you on our next video.